Hello, my name is Dr. Gary Shaw, and I am a ear, nose, and throat surgeon in Kansas City. I've had the opportunity to work with the Colorado micro-electrodissection needle for a number of years now, and I have would like to point out some of the advantage that we found out in a study that we did with tonsillectomies in both adult and children. The Colorado tip needle was originally described for tonsillectomy by Aquila back in 1997. The advantage of the Colorado tip is simple, in my estimation. It is a tungsten needle that is much smaller at the tip than any other product that's out there. Because of that, it allows a minimal amount, with a minimal amount of wattage, producing a very fine heat source at the tip, but very little thermal spread, and therefore very little thermal zone of thermal necrosis in the surrounding tissues. Because of that, it allows for precise dissection with minimal bleeding and minimal pain postoperatively. Let's talk a little bit about the technique that we've employed. Later you're going to see a video describing this technique, but let me point out some of the features. To begin with, the tonsil is dissected usually from the superior pole, making an incision in the anterior pillar, utilizing the Colorado tip at 8 watts power, beginning from superior to inferior, and staying as close as where the surgeon believes the lateral surface of the tonsil will be found. Sometimes this is hard in tonsils that are small and buried, but most of the time one can guesstimate where this is going to be. Always err on the side of being closer to the capsule than further away. The dissection is mostly performed in a supracapsular dissection plane. It's very important to, once the capsule is identified, to stay right on the capsule. Another important feature that one has to pay attention to is to coagulate vessels as they come across. Don't try to lacerate the vessels or tear them. Even small vessels warrant coagulation utilizing the very tip of the microdissection needle. Since it's on 8 watts power and it's on coag, this very successfully coagulates these small terminal vessels that enter into the tonsil. However, if one moves away from the tonsil, the vessels become larger caliber, and then the advantage of the fine tip and low wattage is lost at that point in time. It's important to also note that when moving down the capsule of the tonsil, and it's not depicted here unfortunately, but that it's necessary to have your nurse or assistant retract the pharyngeal constrictor muscle tissues as much as possible so one can have good visualization of the capsule of the tonsil. Again, one needs to stay right on the capsule of the tonsil, and this is probably most important in the inferior pole where the vessels become much larger quickly as one moves away from the capsule. So again, movement of the staying right on the capsule is paramount. Let's talk a little bit about the postoperative findings we see in these patients. If one looks at the standard electrotip microcautery, which is popularly done, most studies report using 20 watts power, and these tend to be associated with significantly more blood loss and significantly more days of pain. Here's one where it's as high as 10.8 days of pain. The bipolar scissors that we had talked about before tends to have also a minimal amount of blood loss, but again, the mean amount of pain is greater, and the postoperative bleeding tends to be much greater, or higher incidence of postoperative bleeding. Moving down to some other techniques that are still being employed, but not as much. KTP laser was introduced in the early 1990s as being a possible acceptable technique for tonsillectomy. But again, a higher amount of blood loss, a longer amount of operative time, and a higher amount of pain experience in the patients in the postoperative period. So I think that when one considers all these other features, the Colorado tip compares very favorably to most parameters that have been described in the other techniques. There's a final point that I want to make too about the Colorado tip. When one considers the cost of the procedure, one has to take into account the cost of the equipment. The microdissection needle costs $40 approximately. A coblation tip wand costs $350. A KTP laser fiber costs $125. And a argon beam coagulator device costs about $25. But I think the real cost comes in the cost of the units that generate the power. Stryker Colorado microdissection needle plugs into any standard power generating unit, which all operating rooms all operating rooms will have a coagulation unit to plug it into. So that cost is really minimal then. But coblation device will cost $20,000. A KTP laser will cost $140,000. The bipolar scissors are $375. An argon beam coagulator costs $100,000. So certainly the cost per procedure utilizing the Stryker microelectrodissection needle compares extremely favorably to these other techniques that have been recently described. We're now going to look at the actual technique for tonsillectomy utilizing the needlepoint electrocautery Colorado tip. 1% lidocaine with 1 to 100,000 of epinephrine is used to infiltrate the anterior pillar bilaterally utilizing a curved tonsil tip needle. The Colorado tip has already been placed on the end of the bovie, and the bovie power unit has been set at 8 watts coag, 0 cutting. It's important to try to identify the most lateral aspect of the tonsil. Sometimes in tonsils that are deeply embedded into the tonsillar fossa, this isn't as easy to do, but it's very useful. The actual procedure begins by grasping the tonsil with the tonsil tenaculum and retracting it medially. The needlepoint Colorado tip electrocautery is then used to make an incision in the anterior pillar just above precisely where the one suspects that the most medial aspect of the tonsil is. A small tonsil suction or Goodhill suction is used to evacuate whatever smoke is produced. Once the incision is made, the Goodhill suction is then used as a countertraction tool. Countertraction is very important. The idea, again, is to identify the capsule of the tonsil, as this is a supracapsular dissection throughout. I find that it is most useful to begin the dissection once the capsule is identified to try to first identify the inferior pole of the tonsil. By staying again right on the capsule of the tonsil, the procedure then allows for identification of any of the small vessels that may enter into the capsule. It's important to stay on the capsule at this point in order to minimize any bleeding. It's often necessary to clean the tip of the tonsil tip, as it is a very small tip and any tissue will affect its coagulating ability. I find just using the surgeon's fingertips as the best tool, and it is not necessary to use any other implements to clean the tip of the tonsil needle. If a vessel is identified, again, it is useful to coagulate it prior to transecting the vessel. Retraction, again, and countertraction allows for this identification. Because of the minimal eschar and smoke, because of the very low wattage used in a Colorado tip dissection, the visualization is usually excellent. Here, bleeding, a small vessel was identified and was coagulated prior to transecting. If bleeding is encountered, however, doing the dissection, it's generally a small caliber vessel because of the supracapsular dissection. The Colorado tip, because it is a coag tool, can still be used even at the same low wattage. I find it useful to turn the from using the very tip of the needle to the more lateral aspect to expose a bit more of the surface area on the bleeding portion, and you'll generally get some very rapid coagulation releasing the last attachments of the tonsil in the superior pole, one can again appreciate how not only is the tonsil bed dry, but there is little, if any, carbon particles. This is because of the minimal thermal damage caused because of the use of the Colorado tip. Again, the thermal necrosis at this wattage, utilizing this very tiny diameter needle, is minimal. And Ariana, how are you feeling now? Fine. Do you have a sore throat at all? Not at all? You feel pretty good? Great. So this is pretty representative of our results with kids after tonsillectomy utilizing the Colorado tip. And generally speaking, as pointed out in my paper, in our study, it showed that kids are back to eating normal diet at about 3 to 5 days. Adults are a bit longer, and very little postoperative complications associated with that. In summary, I think that the Stryker Colorado tip microelectrodissection needle has many advantages for tonsillectomy in both adults and children. Minimal blood loss, minimal amount of postoperative pain, early return to diet, and early return to daily functions are just but a few of the advantages. Clearly, it compares very favorably to many of the other recently described modalities, and certainly the costs can't be forgotten. I urge surgeons who perform tonsillectomy, both in adults and children, to consider utilizing Stryker's Colorado microelectrodissection needle for their patients. Thank you.